neurosciences what the rehabilitation goal is. And as we know that neurological rehabilitation has help patients with neurological disability, like stroke, head injury, or these Parkinson's, and any neurological illness where neurorehabilitation can help people to regain their or restore if possible, or with compensation or adaptation to gain their functional ability. So before that we go ahead, what are the things we do in neurorehabilitation? Let us understand how brain recover. This is the old, I wanted this to be in my slide, because most of times when we talk about past, we used to think that the brain dead is dead, and we cannot have that same function. But thanks to the principle of neuroplasticity, which says that brain is not hardwired. We can remap. Like for example, how many people we are sitting here knows how to play piano? One. Okay. Most of people are not knowing how to play piano. But once we start practicing, there are a number of neurons which are not activated, get activated, and we get trained. And even while talking, I can just press the key and I can produce the sound. There's so much of motor execution takes, so accurate motor task is performed with doing multiple tasks. So that is what the neuroplasticity, and it is a lifetime process of learning, and it happens in 3 ways. How it happens? By definition, Neuro has done a lot of work on neuroplasticity, and it is 120-year-old concept which was practiced for basically for psychiatry. Before that, to relaxing brain and to treat depression and anxiety. But later on, it came in neurosciences and neurological recovery, neurological rehabilitation, and say that to flexible property of brain to get changed temporarily or permanent, and that is called activity dependent plasticity. एक MCD के स्कूल में बच्चे को भेज दें और एक BPS में भेज दें, तो 20 साल के बाद उसके definitely उसकी way of thinking, उसके activity, उसकी behavior, सब चीजों में change आएगा. That's what is learning. The same way, there are a lot of synapses in brain which are inactive, which are not activated. There are a lot of pathways which are not activated. So when with the activity, we try to activate them, and it get activated, and the same function can be restored. There are some techniques which are based on neuroplasticity, and these are the 3 principal components here of neuroplasticity. It works by axonal sprouting. Those axons, when we give load, they sprout together and get attached with each other to form a new connection between the axons. There are many of synapses which are weak, they are not activated. They get strengthened, they get activated, and this is how we restore function. And there are already existing pathways in brain which are not activated. By giving load or activity practice, they get activated, and this is how a task-oriented training can enhance a functional recovery. What do we understand by task here is any purposeful activity. Like for example, if I am trying to lift something, and that is task, walking. So even if I have a good strength in my leg, it is not necessary that I will be able to walk. So the things came, and at once it said that we have to have, if we want to improve writing, we need to practice writing. If I want to have functional ability of hand, I have to do bilateral activity like pouring glass of water and handling objects in my hand. Then only the activation of pathway in brain will take place. Okay? So there are few things which we practice, like this visual biofeedback assisted device, virtual reality, semi-virtual reality, where we basically what we are doing here is we are giving load to the neurons. Like if I want to build my biceps, what will I do? I will take 1 kg of dumbbell, 2 kg of dumbbell and start doing exercises. And once I get that strength, I will increase the load. Right? But here, the brain has no hand or fingers to hold the dumbbell. So what we give in form of task difficulty, we try to load the nerves, load the neurons, so that they get activated to take part. So more the motor unit, more the synaptic excitation, excitability is, more strength comes in muscle. So this is how, because here we get constant feedback. So the more engagement of neurons, and this is how the firing rate in cortex increases, and therefore the optimal recovery takes. So this is the example of bilateral training, because brain understands only the task. Remember that brain understands task, not the movement. Brain doesn't understand fraction, extension, or abduction, adduction, or external rotation. It understands the task. If something I am going to pick up from any table or anything, okay, so I will reach, I'll hold it. If I have pain, if I have restriction in biceps, I will take a stance and go and pick that to complete the task. And this is how the motor planning get changed at higher center, because the peripheral demand we put, and if there is a restriction, so what our aim is to train this performing that task in a most accurate way. That's the task of rehabilitation, right? So this is, there are devices where what is the advantage of these devices? I would say here is to have a very accurate and quantification. We can measure the day-to-day progression, that yes, my patient has progressed so much. The 1 week back, the patient was at this level, and now the level is increased. So active balance training with the motion sensor devices, force we can have those quantification. EMG biofeedback, where the weak muscle can be trained, and we can enhance the participation of patients, because we should understand that unless and until the patient is himself participating and performing activity, we cannot achieve. It is not passive treatment, it is an active form of treatment. That patient has to participate in the exercise program. So increase their participation, engaging their mind, engaging them in the rehab process, is to have certain type of feedback that where patient is, how much patient is taking role, how much patient. So in this EMG biofeedback, what we do, we put in a surface electrodes on the weak muscles, and even the patient has a very flicker of contraction in that muscle, which is not causing limb to move, and that the potential can be picked up with this electrode and amplified, and so in form of a graph or some activity like on the screen, and patient get motivated that yes, I am doing and I have to do something more, and we give a task. Like for example, we draw a line and we ask them to contract your muscle and reach to this graph. So he will try hard, he will try hard. So in that way, we are giving what we are giving load and a target base. So this is how the activation of the new connections take place. This is again example of motion sensor force plate, which can be used to have a feedback. This is something like a dynamic control training. The patient has to keep themselves under that trampoline, and he has, for trunk training it is best used. So to perform the activity in a very accurate way. There are few video here, what we have prepared here, in a stroke patient, a very classical patient here, and in the stroke, most of the time we see, look at that, the hand function is a very poor recovery in stroke patients, and there are a few cases here with very nice recovery. I wanted to show you this. So you can see the first video here, and you can see there is a typical presentation of an stroke patients. Patient was MCA is infarct, and you can just see that after 40 session, so the best possible hand recovery has been taken place. can say. And in lower video also you can see this is the most difficult function to perform by a stroke patients. Like having a very fine movement, fine motor activity. That is also being achieved, and that is very, we're going to publish this. And there are 4 or 5 patients we have accumulated, and we're going to publish in a case series. And again, another video you can see there is a typical presentation of a stroke, upper limb, MCA infarct, and here you can see the recovery. Best possible recovery what we can achieve. This is what the recovery, it is not compensation, it is not adaptation. Usually what we used to do earlier was, the ones the stroke patients, patients suffer stroke and we used to treat them, with something compensation, some adaptation, like one side is paralyzed, start doing and training with other side to perform at this daily task. But no, we are changed, we try to get recovery as much as possible, and when we reach an apathy, we try to then start compensation, not like the day one to believe in compensation or adaptation. This is another case. And there are few study going on here. There is even we have signed one collaboration with this one Israeli company, that brain computer interface device we are developing. So for that the trial is going on here, and this device is based on Hebgen learning principle. Hebgen learning, what is Hebgen learning is, once like for example one motor unit, like it says that neurons that fire together or work together fire together. That's the principle. Like for example, we are all working in VLK and we are all have the same goal. Okay, so once, like best example हमारा भी strike का जामिया का best example, किसी को कुछ पता नहीं है, but once one person is going ahead, everyone is behind them. It is something like that. One neuron get excited and many of follow them. Okay, so we are trying to stimulate that way to have an optimal brain recovery. Right? This is one, it is electromagnetic. And this is at the end, yesterday only I got a mail of one of our patient, and I wanted to share with you people. It is a very young girl, and she mailed me that their recovery. I just converted in a voice, you can just listen.
You and your team helped me recover emotionally and physically, and now I can inspire others. Thank you so much, doctor. Embrace your inner fighter. The pain started to get deep, only to make me feel there is something within that is detaching my right side from me. Pampered at home, being the youngest one, life was so much beautiful than it ever could be. Wanting tremendous love from every family member was my biggest strength back in my good old days, but as we find it, continuous love and pamper might help us lose our destiny, whom we were born to be. As rightly said, only rough seas provide the best sailor. Having lived my single phase in the best mood, it was time for my life to get love struck, and the man of my dreams came into my life. Totally informed of changes and beautiful shifts in my life, I never imagined unpredictable life to shower kinds of phases which I am about to roll out in word.
This is a very long one. I'll just give the core message there, that the person who suffered pain or any discomfort, and if you change their life by doing whatever, it is not an surgery, it is not a rehab, it is not physiotherapy, it is not occupational therapy, any form of therapy, and with any help, if you are able to change their life, I think it is biggest gift to us, and working together here. Okay, so why I wanted to present that, in beginning of I said that there are a lot of things we need my best possible outcome to our patients, right? Hope you agree with that, right? So this is, you know that this is our hospital, and this is how many of you have come downstairs, the department, physiotherapy department? How many?